Assalamualaikum and hi everyone. We are from Group 14 and today we will present to you on our topic entitled Oral Mucositis. Okay, so firstly, what is oral mucositis? According to Ministry of Health 2016, oral mucositis is the inflammation of oral mucosa resulting from chemotherapy or radiation therapy in the treatment of cancer. Oral mucositis also defined as inflammation of the mucous membrane and characterized by ulceration, pain, dysphagia or difficulty in swallowing, and the ability to talk is impaired. These are the clinical features of oral mucositis. The first one is red patches on the mucous membrane. The second one is ulcers of varying sizes ranging from 0.5 cm to greater than 4 cm. The third one is pain that affecting the patient's speech, eating, or even the mouth opening. And the last one is loss of taste. Okay, so this is the WHO Oral Toxicity Scale. This scale is used to measure the anatomical, symptomatic, and functional elements of oral mucositis. There are 5 grades in this scale, and starting from grade 0 to grade 4. In grade 0, there is no changes in the oral cavity. In grade 1, there are painful areas of erythema, but no ulcers are present. Grade 2, there are areas of erythema and some painful ulcers present. Regardless of the presence of the ulcers, the patient can still eat solid food. In grade 3, the erythema present on most of mucosal surfaces and there are many painful ulcers present. Due to the presence of the painful ulcers, the patient can require liquid diet only. And last but not least is grade 4. The erythema present on most of mucosal surfaces and extensive painful ulcers present. Due to that, the alimentation or nourishment is not possible.
The next one is the CT-CAA grading scale. It is to provide standards for the description and exchange of safety information in oncology research. It has 5 grades. The first one is grade 1. It is asymptomatic or mild symptoms. The intervention is not indicated. Grade 2 is presented with a moderate pain or ulcer that does not interfere with oral intake. Modified diet is indicated. Grade 3, it presents with severe pain. It interferes with oral intake. Grade 4, it already extended to the life-threatening consequences and urgent intervention is indicated, and grade 5 is death. Okay, now we will move on to the management and care for oral mucositis. Several general approach has been listed for the management and care for oral mucositis. The first one is by getting effective oral care. The next one is topical mucosal protectants, dietary of modifications, appropriate use of topical anesthetics, and the last one is systemic analgesics. The management of oral mucositis aims to make patient as comfortable as possible and to maintain adequate nutrition and prevent dehydration. So the first management is oral debridement. Oral debridement refers to the removal of accumulations of plaque and calculus in order to maintain dental health. So we can give saline or sodium bicarbonate and alcohol, which is a mucolytic agent, to soften and dislodge them. The next one is oral decontamination. Antiseptic rinsing with chlorhexidine is effective in reducing overall bacterial load. Fluconazole is used for candidal prophylaxis, and antiviral can be used to prevent herpes simplex virus reactivation. The third one is topical and systemic pain management. For adequate pain control, we can give 2% viscous lidocaine, magic mouthwash preparations, and we can give topical morphine solution. Systemic analgesics are used together to achieve adequate pain control in severe cases, and sodium bicarbonate solution can help moisten the mucosa, reduce caking of secretions, and soothes inflamed or ulcerated mucosa.
Okay, so we're moving on to the fourth management for oral mucositis, which is prophylaxis and prevention. Cryotherapy with ice chip is one of the way of doing it and has been shown to effectively attenuate the onset and the severity of mucositis in patients that undergoing chemotherapy with 5-fluorouracil and methylene. It was suggested for a patient to suck on the ice chips for 30 minutes prior to and during the chemotherapy infusion. And the final management is to control the bleeding from the ulcers using topical thrombin packs and topical antifibrinolytic agents such as tranexamic acid in order to maintain the platelets at least at 20,000 cells per microliter. Next is the treatment. Mucositis can be alleviated at home, and here are some tips for managing it. First, it is important to drink at least 8 glasses of water daily, or about 2 liters. Purified or deionized water can help in reduce the irritation. Then, drink sports drinks with electrolytes such as Gatorade or 100 Plus to stay hydrated if indicated. Cut down on or avoid caffeine and alcohol since they can dry out and further irritate the tissue. Eat soft comfort food like ice cream, pudding, yogurt, and many more. Avoid acidic foods and drinks that irritate tissues such as citrus fruit, juices, spicy or salty foods, and even carbonated drinks until you feel better. It is important to avoid all forms of tobacco and nicotine because these can irritate raw tissues like mouth sores and delay healing. Avoid foods and liquids that contain a lot of sugar. Use lip balm for dry lips and avoid breathing through mouth. Water-based lubricant may be used if dry mouth present. For patients with dentures, it is advisable for them to wear denture only for meal to let your gum rest and reduce irritation. And lastly, use a very soft toothbrush and floss gently to avoid irritating the gums. Moving on to the complication. There are some complications that patients with oral mucositis might have to encounter. Such are, number 1, prone to infection. The sores and ulcers easily get infected by bacteria or viral or even fungal as they are exposed to oral cavity. Second one is weight loss due to pain and loss of taste perception make it more difficult for the patient to eat. And lastly, ulcers may act as the site for local infection and as a portal of entry for oral flora that in some instances may lead to septicemia, especially in immunosuppressed patients. Moving on to the case report with review of literature titled Radiation-Induced Oral Mucositis from year 2018. A case involved male 62-year-old patient in India. Oral mucositis is seen as the complication from the radiation therapy that he got for his head and neck cancer. It appeared after 2 weeks of radiotherapy treatment and is said as an early effect of the radiation resulted from the death of basal cell of oral epithelium. This patient required a comprehensive consultation, treatment and care from his oncologist, medical general practitioner, and dental surgeon for his condition.
So in this case report, a 62-year-old male patient named Mahadevapa, resident of Davangir, came to department with chief complaint of pain and burning sensation in mouth since 2 months. Pain was continuous increases on taking both normal as well as spicy food and is relieved by having water. His past medical history revealed patient is known case of carcinoma of periform fossa since 8 months. Since 4 months, he was on radiation therapy along with medication. Family history was not significant. Aside from his personal history, patient was chronic PD smoker since 35 years, 1 packet per day. On general physical examination, all his vital signs are within normal limit. On extra-oral examination, it revealed black color discoloration present on neck extending from right to left ear, lower border of mandible extending till clavicle and shoulder as seen on figure 1. Intra-oral examination revealed fissuring and cracking of right and left corner of mouth. A white tissue yellow, scrapable pseudomembranous layer present over labial mucosa, right and left buccal mucosa, floor of the mouth, and both ventral as well as dorsal surface of the tongue, and hard palate associated with pus discharge from gingival sulcus with severe halitosis, as can be seen on figure 2. Erosions with erythematous areas present over posterior aspect of soft palate and both right and left buccal mucosa, extending up to vestibule as well as retromolar area. On palpation, the lesions were extremely tender and scrapable, leaving bleeding spots. So, with the history, clinical sign, and symptoms provided, the provisional diagnosis for this case is radiation-induced oral mucositis with differential diagnosis of pseudomembranous candidosis. The patient had treated symptomatically. For treatment, until now there is no effective intervention has been developed to prevent oral mucositis in radiotherapy. Prevention of severe mucositis is important because mucositis affects the patient's feeding status, physical and mental well-being, and it can influence the course of radiotherapy. To prevent iatrogenic mucosal damage, irritating factors such as sharp or rough fillings should be smoothened or polished prior to radiotherapy, and prosthetic appliances should be closely evaluated. Plaque control and oral hygiene should be maintained, and teeth with a questionable prognosis and having to be removed before the start of radiotherapy. The use of tobacco, alcohol, and spicy and acidic food should also be discouraged. Recent systematic reviews and clinical trials have identified potentially effective approaches for the prevention of mucositis, namely the use of allopurinol, growth factors, and povidone-based mouthwashes, hydrolytic enzymes, amifostine, sucralfate, and antibiotics, honey, low-intensity lasers, oral hygienes, analgesics, and anti-inflammatory drugs. Only the administration of antibiotic lozenge has been shown to be of some use in the reduction of the severity of radiation mucositis. Results with the administration of growth factors and radical scavengers are promising and need further studies. Focus not only on the prevention of the disease but also on the potential effects of this therapy on tumor response. In conclusion, the present-day management of oral mucositis is mostly palliative and or supportive care. This includes good oral hygiene, avoiding irritating or abrasive substances, use of blend rinses, topical anesthetic agents, and systemic analgesic. So the newer guidelines suggest palifermin, which is the first active mucositis drug, as well as amifostine for radiation protection and cryotherapy for symptoms related to high dose melphalan. The role of safe radiotherapy remains the ultimate goal in reducing the symptom of radiation-induced oral mucositis. For these drugs, future research are required and the current management should focus more on palliative measures such as pain management, nutritional support, and maintenance of good oral hygiene.
So, based on the mentioned conclusion, it is significant to understand the fundamental role of providing a good approach on managing oral mucositis. This generally consists of a wide vast of ways where patients with oral mucositis have to follow for an effective solution. From the case report itself, Kamala had mentioned about the mucositis prevention therapies in a summarized table as shown, among which includes a good oral hygiene and infection prevention, which includes taking a microbial lozenges, chlorhexidine, clindamycin, an antiviral medication such as aclovir, and also an antifungal medication like fluconazole, whereby different prevention medication would depend on the etiology of the oral mucositis as we have discussed earlier. Another method is by taking an anti-inflammatory agents, which include prednisolone, whereby it is crucial to control the main inflammation components of mucositis. Next, it is also advised for patients to take reactive oxygen species inhibitors like amifostine. This is to stabilize the cell membrane from continuously being damaged due to the presence of these species. Furthermore, salivary function modifiers such as pilocarpine is also mentioned. This is important for the stimulation of the salivary gland to enhance the mucosal healing, whereas azolastine 2 is an agent-reducing cytokine released from the lymphocyte, have shown to reduce mucositis by again suppressing the reactive oxygen production. Next is the oral cryotherapy, also known as a cold therapy. Due to its general use of low temperatures, it has been confirmed to treat oral mucositis. Next, glutamine is also said to delay oral mucositis by decreasing the mucous membrane injury by altering the inflammatory response. And as for coating agents, which is due to its ability to bind to the ulcerated epithelium, sucralfate serves as a protection and offers comfort to those with mucositis. Moreover, Laser therapy as well promotes pain relief and reduces the severity of mucositis. And finally, as for growth factors, which are divided into certain factors, have provided an intense amount of interest currently towards its reaction for oral mucositis treatment. There are essential proteins that stimulate the cellular growth, proliferation, and regeneration of tissues. Thus, it have the self-healing capacity of patients can increase by the use of growth factors, whereby its epidermal growth factor, granulocyte, colony stimulating factor, or fibroblast growth factor, they all carry a significant role in preventing the chemoradiotherapy mucositis. On the following slide, also obtained from the same case report, is another table consisting of the different treatment modalities by different authors for oral mucositis, whereby the main point is that each of them would give out similar suggestions in treating mucositis, and so strengthening the source of each treatment. One of which is mentioned is on the locally applied non-pharmacological methods, that is by oral hygiene, which does show significant decrease of incidence. Also the same for radiation shields, which wasn't mentioned before, but from the authors, they have stated the use of midline mucosa sparing blocks and customized beam shaping would help. Another modality is locally applied pharmacotherapeutics, which includes mouth coating agents, sacrofate, both mentioned previously by Kamala, and also qualimpectin, which is a combination of oral hygiene and sacrofate over diphenylhydramine and qualimpec. There is also the antiseptic and antibiotic agents, which include hydrogen peroxide, chlorhexidine, and PVP iodine, all of which shows different results in treating oral mucositis. Next is the antifungal agents such as amphotericin B, which have shown to decrease the mucositis severity. Furthermore is the anti-inflammatory agents like chamomile, betamethasone, and benzidamine, all showing positive results towards prevention. The result is also the same for cryoprotectants for the treatment of mucositis. For this slide, it demonstrates another management of oral mucositis obtained from Kementerian Kesihatan Malaysia, which is the control of bleeding, whereby the use of topical thrombin packs and antifibrinolytic agents are important for the reduction of bleeding. That is by preventing the dissolution of clot and act to inhibit the plasminogen activation. The other available medication for relieving mucositis are palifermin. As we talked before on the role of growth factors, it is shown to promote the epithelial cell proliferation, differentiation, and migration. Cytokines are modifiers of inflammation include interleukin 1, 11, and the transforming growth factor, TGF-beta 3, amino acid supplements, vitamins, and colony stimulating factors. There's also Gelclair, which serves as a barrier protection agent. Next is MuGuard, which is a mucoadhesive oral protectant to form protective hydrogel coating over the oral mucosa as the patient is undergoing the chemo or radiotherapy cancer treatments. Next is Nutracell, which is an FDA-cleared calcium phosphate mouth rinse. There is also Episil oral liquid, which is to create a lipid membrane that mechanically bonds to the oral cavity mucosa by coating and soothing the inflammation and ulcerations. It is also to blanket the painful lesions. Lastly, a water-based hydrosopropyl methylcellulose film forming agents which acts as a lubricant and mucosal barrier. This is perfect for the treatment of oral mucositis. As a conclusion, there are so much treatments that can be done to overcome mucositis, and it is important for people to educate themselves for its ways and its function. And these are the following references used. Thank you for your attention and stay safe.